Welcome to Health First Foot and Gait Clinic, and thank you for following us. And today we're going to be looking at the problems that we get with toenails. There's all sorts of different conditions that can affect toenails, and I'm going to talk to you about several of them and what we can do to help you with those. So one of the most common toenail problems is fungal toenails. Athlete's foot type infection actually affects the toenail, and that can lead to unsightly, what we call dystrophic toenails. They can be thickened and yellow and uncomfortable and difficult to cut, and they can be a bit of a bugbear for appearance for patients as well. Fortunately, there's lots that can be done to resolve fungal toenails, from removal of the nail to tablets to treat the fungal nail, or different treatments involving debridement or drilling of the nail and application of topical treatments. The off-the-shelf treatments that you can get from your pharmacist, unless it's a very mild infection, probably isn't going to be that successful in resolving fungal toenails, and particularly if it's extensive infection and or over multiple nails. And indeed, NHS guidelines for treating fungal infection in toenails with tablets is at least 3 toenails need to be affected. So there are treatment options that are available. So if you've got fungal toenails, then don't give up on them. There may be things that can be done to help you. One nail condition that looks similar to fungal toenails is something called Onychogryphosis, where you get a thickening of the nail. It's different to fungal infection though, because the cause is different and the nature of the nail plate is different. In an onychogryphosis, a ram's horn toenail, it literally can look like a ram's horn, where you get this thickening hardness of the nail, often caused by trauma to the nail bed, or either as a one-off trauma or repeated micro trauma, whereby your toe might bang against the end of, say, a steel toe cap boot over many years. And that can lead to this condition, onychogryphosis. We have tools in clinic that allow us to thin that nail right down, get it looking more like a normal nail again, or we can remove the nail and kill the nail bed so you don't get any nail regrowing at all. If we go with the thinning route, we can always reconstruct the toenail to make it look like a more normal toenail, which a lot of patients appreciate themselves having a more normal nail, particularly when they're wearing sandals. You can also get other types of thickening of the nail. Onychogryphosis is a generalized thickening of the nail that generally occurs as you're getting older. Generic thickening that we would use and drill to thin down if you're struggling to cut the nails, or you can file the nails regularly to keep on top of them. Another common nail condition is ingrown toenail, and that's where the edge of the nail penetrates the flesh at the side and you actually get an open wound. Only when it becomes an open wound is it truly an ingrown toenail, where you get maybe some bleeding or some pus developing. Before that, it's common for it to be either a very wide nail plate or an involuted, where it's curved into the corner, or a convoluted nail, where it's excessively curved into the corner of the nail, sulcus, which is the edge of the nail. Ingrown toenails can be painful. They can mean that you need to have antibiotics. But the way to resolve it is to cut away the edge of the nail that's penetrating the flesh, that's pressing into the flesh. And that can either be done just as a treatment using sterile instruments, where we gently cut away the side of the nail, generally a pain-free procedure if done correctly, or you can have local anaesthetic and have the edge of the nail cut away, or even permanently removed and a chemical put on the nail bed to stop it from regrowing. There's also other surgical procedures, but in my experience of 30 years in the profession, I've not had to refer anybody for a different surgical procedure for ingrown toenails than this partial nail avulsion with phenolization of the nail matrix. Very quick and easy solution to ingrown toenail, and you'll find a video on our YouTube channel that shows that procedure taking place. You can also get pain around toenails, not because of involution or ingrown toenail or thickening, but actually because there's a callus or a corn located around the side of the nail or underneath the nail. Those can be quite painful, particularly when you're putting your shoes on, and they are readily removed using a gentle scalpel technique and maybe drilling the nail to get to those lesions and remove them. And even it's possible for those lesions to actually break down and ulcerate, and we get something called a subungual ulceration, where the tissues have actually broken down and can lead to infection, and need appropriate care to get them healed. Also, that can affect around the nail and on the nail plate itself is a melanoma. Cancers can affect the toenail, and Bob Marley actually died from melanoma affecting his toenails. So it's important to make sure you do get anything suspicious checked out by a foot specialist podiatrist to check them, make sure there's no concerns with any nail condition. Sometimes nails go thicker, painful, deformed because of underlying issues with the bone underneath, and you can get a lump on the bone called a subungual exostosis. And there's special diagnostic techniques we use to look for those. Sometimes we'll refer for X-ray, but sometimes we can just do it clinically to get that diagnosis and then discuss appropriate treatment plans if that's the case. It's important to realise that when you get toenail problems, if you've got reduced circulation or high risk feet in diabetes, for instance, that you don't ignore toenail problems, because they can lead on to more serious issues that could ultimately result in ulceration, infection, amputation, sepsis, or even death. And one of my saddest stories from my long career in dealing with feet is a patient who had an ingrown toenail that had never been referred on to anybody who deals with feet on a regular basis, and they'd had multiple courses of antibiotics, and I eventually saw them when I was working in the hospital in Warwick Hospital. I ran the diabetes department for foot disorders, to help to save patients from being amputated and losing their legs. Unfortunately, he came in when it was all too late. He'd actually presented with gangrene to us, and he ultimately died from what was a simple ingrown toenail that could have so easily been fixed by a podiatrist. So there's a brief overview of many of the conditions that can affect the nail, multiple nails as well. I hope you found that interesting, and of course, if you want to find out anything more about toenail problems or any foot disorders, please have a look on our website, www.healthfirstsoutham.co.uk. Have a look at our blogs, have a look at our virtual podiatry page. You'll find lots of useful information there. Also our YouTube channel at Health First Foot and Gait Clinic. Subscribe to that and you get notifications of new videos coming out. So make use of the free resources available, and if you've got any concerns, call us on 01926 811 272, and you can also access online booking to see us via our website or via Google. Thank you very much for watching today. Hope you found it useful.